Well, joining me now are Nicola McCrudden from Homeless Connect and Nigel Ruddle from the ambulance service. Nigel, if I come to you first, give us a sense of the challenges your crews are facing day and daily on the ground.
Well, this is a problem we see right across Northern Ireland, particularly so in urban centres, and certainly every night in Belfast we will see a couple of incidents of patients being overcome by the effects of these overdoses, and we've seen more than a doubling of this between 2020 and 2021, so it is having a significant impact.
How thankful are you? We saw some of those voluntary organisations in our reports. How thankful are you for the work they're doing to save lives?
We're hugely thankful for any initiative which can allow for early intervention, because minutes matter in these cases. These patients will die unless they get the antidote or first aid, and anybody who can provide that, we really value their input.
Nicola, you've worked in the housing sector for 25 years. This is wider than a homelessness problem, but what are some of the solutions?
Well, first I'd like to convey condolences to the families who've witnessed young people dying on the streets, and also to our staff who are really stretched. They do amazing work in outreach services. What we need to see is proper funding, so that we can attract the staff and retain the staff that's needed. We also need to see more joined up resources in terms of the statutory sector, but there's limitations on what can be done if we don't have an executive in place, and that's one of the problems that we're facing at the minute, because we do need to see funding coming down. We need political leadership, we need those right policy decisions to be made that will make a difference on the ground and help to save lives and help to prevent homelessness.
What are some of those direct challenges at the moment, and what difference would it make having an executive?
It would make a massive difference. There's a project at the minute called Complex Lives, which is being coordinated by Belfast City Council, the Housing Executive Probation Board, Justice and Health, and that's really changing lives. It's helping to take people off the streets and give them the support that they need. We need to see intervention pathways so people can be fast-tracked into treatment services, and all those things can only be done if the right political decisions are made at the right policy level. So we need to see that government in place that can make those changes that can happen almost immediately.
And secure funding and give stable funding. How important is that?
Absolutely. We're lurching from quarter to quarter at the minute. There's no certainty around budgets, and that's no way to plan services. So what we need to see is security. We need to have a budget. We need to know what we're working with so we can plan for the future, and at the minute that's just not possible.
Well, Nigel, if I can get a sense from you, you deal in emergencies. How much are we facing a public health emergency at the moment?
Well, there's no doubt the answer to this is not just responding at the time of an incident. We would much prefer that there's primary prevention, that we look at the reasons why people end up in this situation, and they are multifactorial. It is a burden on our services, yes. We don't make any judgment when we get one of these calls. We are there to help at the point of need, but it is having a significant impact on our services at present.
You're a healthcare professional. What do you think some of the solutions are?
I think we need to look at all the social factors that lead to somebody ending up in this situation where they feel that using these substances is their best option, and why they end up in that position.
How do we, what is the way forward? What is the pathway forward now?
Well, in terms of homelessness, the Housing Executive has a blueprint in terms of helping to prevent and alleviate homelessness. Now that strategy needs to be funded again, so while we can do the best that we can with the resources that we got at the minute, it's basically much a sticky plaster approach, and we need to see investment in prevention of homelessness and also in prevention of addiction.
And Nigel, your teams will be out on the streets again tonight?
This night and every night. We would expect several calls every night for this particular issue alone.
Well, I want to thank you very much for joining me.